Thank you for being with us in The Loop. This is the podcast where we explore the big issues facing health and care by discussing them with leaders, policymakers, and change agents in this field. I'm Neil Dixon, a former broadcaster who at one time led the NHS Confederation, the General Medical Council, and the King's Fund. Not, I must say, at the same time.
Neil, I believe if any man could have done it all at once, it would have been you. Hello, very nice to see you again.
That was Roy Lilly. Our guest this time is Claire Murdoch. Claire has just stood down after nearly 10 years as NHS England's National Mental Health Director. She's a mental health nurse by background, and she's also Chief Executive of Central and North West London NHS Foundation Trust. In her resignation letter, Claire wrote that it was common knowledge that change at the top was wanted, and that she could no longer lead the sector when the political leadership didn't want to engage with her. But this appears to be about more than personalities. Her letter laments the fact that mental health spending has not kept its share of NHS funding. That fell last year and will fall again this year, and she predicts it's likely to do so over the next 3 years. And she went on to claim that the NHS has not made enough progress on tackling inequalities or reducing the premature deaths among patients with serious mental illness. And she goes on to suggest that while a lot can be done without more money, much of what needs to be done does need extra investment. Like many mental health chief executives, Claire has had her own troubles to deal with. The 2023 Care Quality Inspection report rated her organisation overall as good, with an outstanding mark of its care, but it also highlighted aspects of its services that required improvement, including patient safety, again, like so many other trusts. Perhaps more importantly, the sector is in serious trouble with performance, apparently getting worse, and the ever-present pressure with too many patients and not enough staff. The sector received 5.2 million referrals during 2024, not far off from a 40% increase since 2019. Half of mental health and community trusts were downgraded by NHS England in its new performance rating regime, with more mental health trusts receiving the lowest score. More than 2 million patients, including more than 500,000 children and young people, are on mental health care waiting lists. Some children and young people wait for years for treatment. And if you need urgent help, the story's no better. Only 20% of adults with a very urgent referral were seen within the 4 hours as set out in the NHS Constitution. Roy, it'll be fascinating to hear Claire's perspective on all this, and I understand she has incidentally received overwhelming support from fellow chief executives as she steps down.
Neil, it's true, she has. And she sent me a photograph of her office. It looks like it's the florist shop. People have been sending her bunches of flowers and good wishes. She's very popular, but she's very popular in a sector of the NHS that clearly is facing difficulties, and the extent to which the problems have been created by staffing, training, funding problems, I don't know. But the big question really is, did she step down or was she pushed?
Obviously, there is an issue here about her relationship with the top team. I suppose one of the things that we may want to reflect on is this typical of what is happening at the top of the NHS at the moment, or is there something special about Claire? And I suppose the second thing is there, in essence, a sort of conflict of being a chief executive and being the director of mental health? Although, to be fair, she's managed it for, nearly 10 years.
Yes, I agree. I've always thought she's an important part of the NHS repertoire of care. It needs its own director, and the director should be full-time. I can't see how it can be done part-time. On the other hand, you can argue quite convincingly that having a trust chief executive doing it, they understand the issues of the day-to-day running of mental health and understand more what needs to be done. So there's an argument both sides, and we should ask Claire what her view is. But as far as the overall position is concerned, that what she has been dealing with, I think we've just neglected mental health. I'm not saying she's neglected mental health, but I think as an organisation, the NHS has always really treated the mental health services as a forgotten Cinderella. People with mental health problems are complex, they're difficult, it involves often social care, it involves benefits, it involves family structures, and it takes a huge amount of effort and resource to look after people that are seriously mentally ill. I mean, I'm not talking about the new cadre of mental health people who've suddenly appeared after COVID, but this will be an interesting 40 minutes.
Either way, whether you look at those who are suffering anxiety and depression, that side, which has ballooned up for various reasons, but also, as you say, the management of people with serious mental health issues is itself, by the sound of it, it's in crisis. And again, the question for the politicians, especially politicians who've relatively recently inherited all this, is not how bad it is, though we need to understand that, but also how honest are you being about both how bad it is, but also what you're going to do about it. And realistically, where is it in your priorities?
Well, it's pretty low in the priorities, I think. Wes Streeting talks endlessly about the NHS, but never about mental health. Of course, from the politician's point of view, if something goes wrong in the NHS, it goes wrong. It's usually very serious, and I'm not downplaying it at all. But when something goes wrong in mental health, it's very serious, as we've seen in recent news items where people have been not properly looked after and have ended up causing the deaths of innocent people. When it goes wrong, it's catastrophic. And I'm sure that's in the mind of the politicians as well. What do we do about this? And of course, we know what to do. You've got to spend some more money in helping people be looked after better. Never in my experience have we had a government that really understood mental health. I can't recall a government ever being on what I would call properly committed.
I'd say there were moments in a number of administrations where you got both either a Secretary of State or indeed the minister responsible who was innovative and trying to do their best. The issue is, of course, very largely people don't last very long in these jobs, and it is very difficult to sustain that level of commitment while all the other pressures are upon you. So that's not to excuse it, but I think you're right. And if I reflect to my BBC time in the 1990s, I did a huge number of reports about mental health services failing, about people committing terrible crimes because they had stopped taking their medication and they'd not been effectively managed by the service. So not for the first time, Roy, we're coming round again.
Well, let's see what Claire says.
Indeed. Let's welcome Claire. Well, hello, Claire. This has obviously been a very difficult, traumatic week for you. But let me be bold, if I may, with that first question, which is, have you stepped down? Were you pushed or did you jump?
My resignation letter says as much as I need to say about this, which is I wasn't wanted by the political leadership. Immediately that happens, you don't have the power you need to do a good job for patients. And so it's better that you step aside quickly and let a new regime take power and do good for patients. It's hard to say you're not wanted. So I decided to just be honest about that. It's okay. Government have a perfect right, indeed a duty, to choose who it is they want to work with, who it is they want to lead. And that wasn't me anymore.
It's bizarre, really, looking at this from the outside, Claire. I mean, did you have a falling out with Streeting? How did Streeting treat you?
In truth, I was so excited about a new government and the opportunity to push hard and go again. And so I'm still bemused as to why that happened.
Claire, it's just bizarre. You walk into someone's office expecting some sort of operational conversation about the future and you end up telling them to shove their job. What was in the run-up to this?
Look, I was really excited about the next phase of the plan because we've had a plan. I'm really proud of what the sector's achieved. And it was job begun, not job done, for whatever reason. And I think really you'd have to ask others, creating that plan and getting a move on with it has been difficult. And so perhaps there were frustrations about pace. I honestly don't know. Nobody has talked to me directly.
When you talk about pace, I mean, you need the money to do that. And clearly the mental health guarantee of funding has not been fulfilled. And it looks like there's about 300 million quid short in the funding going forward. The Royal College of Psychiatrists are claiming. You know, I've got some numbers here. Probable mental disorders in children have gone from 1 in 9 in 2007 to 1 in 5 by 2023. For those 17 to 19, the rate increased 1 in 10 to over 1 in 4. by 2022. Demand for services for young people has gone through the roof. Common mental disorders like anxiety and depression. There's huge pressure on the system, despite whatever the incoming government might have inherited. So, I mean, there's a lot to be done.
I use the phrase job begun, not job done. I'm fiercely proud of the job that was begun. Simon Stevens had the absolute clarity and forethought of the need to create mental health as a priority. We had a plan. It is a matter of fact, and the National Audit Office reiterated in 2023 that the mental health plan had been enacted, there'd been strong leadership, there'd been financial ring fence and support, there'd been clear expectations, there'd been a workforce plan, there'd been clear governance across the country, and all of the things really that are your bog standard management plan. So we've achieved a lot, and we did that through a mixture of innovation, determination by fantastic people across the country, wonderful partnerships with third sector, clarity of what we wanted to achieve, and we did achieve it. And what's clearly needed is the plan for the next 5 years. Multi-year funding, the outcomes that are expected, clear implementation. Yes, we've stalled on the finance and the multi-year funding settlement. That needs to be clear soon. There's been an accusation that all we care about is the money. All we care about actually is the patients and the staff delivering the care. Money is one thing. The sector must drive productivity. Is it deriving best value from every penny? That's the reality of the world we're in now. It does deserve, and it must have, in my opinion, share of spend protected. So whatever the NHS settlement is, this commitment in recent years to preserve share of spend for mental health has been phenomenally helpful. For example, children and young people. We saw this huge increase in prevalence at the beginning of the plan with the protected ring fence. We had 9,500 professionals working in children and young people's services. As of today, we have about 21,000 trained children and young people's professionals working in teams. We've doubled the workforce. That didn't just happen. There was a clear statement of commitment to children and young people. We created new roles, these mental health support team therapists in schools. So we had a plan that enabled us to do a lot. We now see twice the numbers of children and young people that we did. The mental health support teams in schools, they've been a game changer. And by the end of this year, we'll have 60% of the country covered. We've achieved what we said we would do. We never said it would be job done at the end of that 5-year plan. In fact, what we said was we need a plan to 2030. And so when we started the long-term plan, can you imagine being proud as a country of seeing 25% of diabetic children? We'd be ashamed. We now, despite that increase in prevalence that you pointed to, Roy, we're now seeing 50% of all children and young people with a diagnosable, treatable mental health disorder, despite that increase in prevalence. So we've had COVID. That did disrupt mental health and all of the NHS. And my dearest wish is that we continue pace and momentum around children and young people, because we've got to keep growing that workforce. We need 100% coverage in all schools. My ex-team nationally, who are amazing, have a clear plan. So I suppose I would say one of my big hopes is that we understand mental health's not some bottomless pit, because as soon as you put it in that category, well, you don't have to do anything about it, do you? Because you can't do anything about it. But you absolutely can. And I'm proud of colleagues across the country who've worked really hard to ensure that we now see 50%. I'm ashamed of 50%, by the way, not good enough, of all children and young people. And I'm proud that we've doubled the CYP workforce in this country.
Accepting the fact that you've done a lot, do you accept we are looking at a sector that is really struggling, in which NHS England has downgraded the ratings of lots of trusts? What's your view about where things are at now from the point of view of a patient who is still waiting, like the 50% you mentioned? You mentioned that things are, in a sense, getting better, but in a way it does look as if, in spite of all that you've done, that the sector is struggling enormously with the increase in demand, whether it's demand at the serious end and also this other huge increase in demand, as I understand it, from people suffering or apparently suffering from anxiety and depression.
I mean, you'd never prescribe half a course of antibiotics and expect to cure an infection, would you? So the first thing I would say really is we were really clear in the plan. This was a beginning of a job, not the end of a job. And then we had COVID as well. We know that that changed mental health need and demand. And we saw a particular spike, and we are still seeing a particular spike in demand for neurodiversity assessments and support and ADHD assessments and support. So when one looks at the waiting list both for adults and children and young people, these two things have contributed hugely to the spike in demand. So it's essential that whatever comes next, there's rapid action on ADHD. But we know what we need to do there. Just crack on and do it. Same for neurodiversity assessments.
Okay, you sounded as if you were almost excited by the change of government and the opportunities that it might go, but your narrative now seems to suggest that this has not just been a disappointment, but a massive disappointment, because the last administration, while it did make mental health more of a priority than it had been, was not funding the NHS or getting things done in the way that a lot of people thought should happen. How disappointed are you with the current administration, if I can put it that way?
Look, I'm not going to criticise government. I'm going to say that I am disappointed that share of spend on mental health has fallen. We've pushed it year on year with all of the things I've mentioned, up to 9.1% of share of spend 2 years ago. It's fallen to 8.7%. And my own view is, and of course these are not official figures until they're reported to Parliament, is that share of spend is falling. I'm disappointed about that. I don't think that it will enable the sort of multi-year clear planning that we've had. I know that I will be accused of only caring about the money and inputs. Well, guess what? Inputs do matter. You know, without the right inputs, workforce, digital, investment, it's hard to get the right outcomes. So I'm disappointed that that appears to have stalled, and I'm really hopeful and determined that we should get back on track with a clear plan. And if me clearing out of the way helps that, I'll help from the sidelines or I'll disappear completely. You know, whatever it is, frankly, that helps people with mental illness in this country most.
Claire, can I ask you about doing the job? Effectively, you were the director of mental health services on a national basis, but you are the chief executive of our biggest mental health service in the country. It's a huge organisation dealing with some very complex people. Is it a part-time job? We could say with some legitimacy, we need somebody doing this 24/7. If we really care about mental health, it's not fair to ask someone to do it part-time. And it's certainly not fair to ask someone to do the job running the biggest mental health facility. The other side of that argument is, well, why not? Because here you've got someone who really understands mental health at the coalface. So of course they should be running it centrally. I mean, what decision would you make now replacing you? Would you redefine the role?
When Simon asked me to do the job, I looked at my own life, and my kids were going to university, and you can't spend too much time with your husband, can you? He'd hate it. So I just decided that I was prepared to do an 80 or 90 hour week, and at this stage of my career, throw everything at the opportunity. And of course, that meant never taking my eye off the ball with the trust. It's in my DNA that you don't separate work from life and life from work. You know, they're part of what you do. So for me personally, yes, I've worked very long hours and hard, and I've just decided to expand that. That's all right. It's been a blast. I mean, what a privilege. The really important thing is people can run global corporations well, you know, much bigger than what I've run. Why? What do they need? And it's all about the people they've got. My own belief is that the National Mental Health Team that I've had the privilege of being part of and we've built is probably still, even though it's shrunk a lot, is probably still one of the best mental health teams of anywhere in the world. My executive colleagues back at the Trust, I think I've got one of the best executive teams in the country, and they have been a huge support to me in my national role. I definitely was always available to both jobs. You can't split your days. So 2 great teams, thank you. However it is structured in the future, the one thing that was in Simon's mind when he gave me the job that I think is important is any fool can make a plan. If it's not hitting the front line, if it doesn't translate, and trust chief executives above all and their teams know whether national promise is translating into their day-to-day reality. So for me, personally, it was the right time to work harder still. I've loved it. My two great teams are phenomenal and I'll be forever grateful to both of them. But it's the work of people across the country that deliver the change.
So to answer my question, you are unique. My question is, would you recruit again someone who is a trust chief executive to handle the national role part-time?
I think it is a really good model. So personally, It's a model I favour. But as you're saying, Roy, whichever model you opt for, there are pros and cons. I think there's something more important still than that. And it was a discussion I had with Simon Stevens back in the day when I said to him, I can't be a figurehead. I have to have some authority and power to get some things done. The important story is not so much the hours the person has, it is the backing to have a real plan with real funding, real support, real workforce, real share of the digital cake, real share of the estates cake, freedom to innovate and to be able to garner the respect of the sector. That's really the important thing, to have the power to get things done.
Claire, obviously you had a Care Quality Commission report in 2023. You got good, you got outstanding in terms of care, but there was also criticism of some of the aspects of the services you run. I think that also, alongside the question of is a chief executive who's got lots of experience and is involved in frontline care, was that not difficult for you coming under criticism from the Care Quality Commission while you are the Director of Mental Health Services?
Yeah, I mean, I think whenever there's a shortcut, look, the thing that will always give me sleepless nights, I mean, one of the benefits of being very experienced is not much gives you sleepless nights anymore because you've earned your stripes and you recognise a problem when it presents itself and you know what to do. The thing that will always give me sleepless nights will be lapses in quality of care, for example, and there's not a trust in the country, even the most outstanding ones, who will not have things that are not as good as or are less than they ought be in terms of delivery. And the job of a chief exec is to really have colleagues at frontline leadership levels and everything between them and the board who understand what's gone wrong, why it's gone wrong, how do you put it right, a will to put it right, the confidence and bravery to try different things and to own it when it's not good enough. And there's not a trust in the country that won't have similar problems. Yeah, the bit that hurts most is one single patient gets substandard care. That hurts. It will always hurt.
There have been some pretty tragic events as well, haven't there, where people with mental health problems have not connected with their community psychiatric workers, they've not taken their medication, they've ended in catastrophic disasters and murders in some cases. When you look back on that, is there anything realistically that we can do about that? I mean, the families always want to blame the mental health services, and one understands that, I do, but also knowing the difficulty in managing mental health patients, the fact that we're a hospital, not a prison. What are your thoughts around some of those really difficult circumstances?
We no longer incarcerate people at the age of 14 or 15 with a diagnosis of moral deficiency. We don't lock people up forever as we did back in the day. We've come a long way. During that period, from then till now, mental health homicides, and indeed in the last 2 decades, suicides have fallen. They've plateaued in the last 3-4 years, but there have been some very big changes in the trend of those things. Now, you have to think, what does this tell us? It certainly teaches us that just locking people up doesn't solve that problem. It tells us, I think, that relational care, having a good workforce who are experienced and well trained, having a workforce who have the confidence to work not only with the patient who may have challenges, but with their families and listening to people who know and love them best, making plans and contracts together with such patients that have really robust follow-up. Much of this comes back to the ruthless reliability of multidisciplinary systems. So, for example, a few years ago, if I look at inpatient nurse vacancies, they were at 23%. How we expect to have good systems of handover, understanding risk and opportunity, having a relationship with somebody with that kind of vacancy factor, I do not know, which is why, for example, we've doubled the number of nurses in training over this period. We've grown the mental health workforce by 40,000 in recent years. We now train 5,000 mental health nurses a year, not 2,500 a year. So I suppose my feeling about those tragedies is I weep at each one I know of and read about, but we need those trained individuals working as part of multidisciplinary teams.
Might a new Secretary of State coming in say, oh, hold on, we put all this money in, we're training many, many more staff, and yet I'm also being told that this service is on its knees. How do I square that? Is this a question that we put these people in, but we perhaps haven't got the productivity or whatever else it is that we need in order to transform the service?
First of all, there's always more scope for greater productivity, and I'm not scared of the productivity word. It's got to be couched in what does value and best value in healthcare look like, so it can't just be a million widgets. But it's all right to say, are we optimising every penny? And mental health, just like the rest of the NHS, must lean into that. Your first thing can't be to reach for more money. It has to be always to ask ourselves, are we doing the best with what we have? When we talk about mental health's had all this extra money, everybody's so grateful for it. But I do remember Lord Pryor when he was chair at NHS England, and I was waxing lyrical about how exciting the opportunity was to have the investment standard and the share of spend commitment. Him saying, all right, Claire, calm down. At best, it's going to be 0.5% more than the rest of the NHS has in order to try and fill a treatment gap that everybody knows is unacceptable. Now, look, I've been grateful for every single penny of that money. And my mailbag is, I can't even begin to tell you, the only thing that's made me want to cry this last week has been the goodness of people. And what hundreds of people are saying to me is, we had a chance and we have made a difference with the money we've had. And the hundreds and hundreds of letters in my postbag tell me that people across the country, it's not what Claire Murdoch says, is it? At the end of the day, it's, did it make a difference out there? And did people feel they had a chance to do some of what was needed for patients? And they did.
Claire, we're coming up against the end of our time, I'm afraid. And it's been really interesting to listen to in your reflections. I just wonder if you were to talk to your successor, where does mental health go now? Because clearly there isn't enough funding. There are more people being treated, but there are more people who need to be treated. Do we completely redesign mental health services? Do we walk away from some of the services and say that's not really mental health? What advice would you give your successor?
If I may, just firstly on the personal point, I think I started by saying, of course, it's hurtful to be told you're not needed anymore. But to be honest, that's insignificant. It really is. I've had a blast. All national roles come to an end. How did I survive as long? So I just am very, very grateful for that, but overwhelmingly so. My main emotional response is, just as you say, for the sector and what next. There are some no regrets moves. So don't take your eye off the waiting list. Have a proper waiting list initiative supported by workforce productivity, optimum service models. Work on good quality data, essential. We were about to have a massive push on data and data inputs and outcome measurement when the pandemic struck, and that just became not the priority. It was do the do and worry less about all the inputs. We have to worry more about the inputs now. And, government, for example, and Jeremy Hunt did this before he left, absolutely rated our talking therapies programme because OBR and Treasury had noticed that the talking therapies programmes that we've been running, but they've noted that that has a direct impact on employment and keeping jobs and finding jobs. So for me, the priorities are waiting lists, within that children and young people, making sure that assertive outreach services and those for the most seriously mentally ill are properly invested in, building on these SMI neighbourhood pilots, because the early signs are they're reducing admissions, they're driving driving better patient outcomes, and they're a more cost-effective way of running services. Keep rolling out the Talking Therapies programme. Let's be the first country in the world to have mental health support teams in schools everywhere. So these are my immediate NHS priorities, and crack on and do them. You know how to do them. Don't throw it all up and start again, because there's not something out there. We look globally, we work with academics, we look to the evidence base, we don't just make it up as we go along. There's not a fantasy thing out there that will solve all these problems. To keep doing some of the hard yards of this, whilst, of course, looking cross-governmentally at the work of DWP, of crime and justice, of housing, of the economy, of education. There is gold in the hills of cross-government working and cross-societal working when it comes to prevention or living with long-term serious mental illnesses, if you can get those things right. So we did have a really good go at that under Sajid Javid and Penny Mordaunt. They, for a year, set up an amazing cross-government ministerially led working group on mental health. And it was a pleasure for me to see so many ministers all coming in to talk about what they were going to do for better mental health and a mentally healthier society. That's absolutely essential, because the NHS can't do this on its own. But the NHS does know what it needs to do next. Digital, digital, digital. Massive opportunity in there. So that's new and different.
Claire, it's been really interesting to talk to you, and thank you for being so frank with us. So what's next? You're going to carry on with the trust?
Oh, I love my trust. It's where it all stands or falls. Everything else we do all stands or falls by what happens with patients. So I'll negotiate with my team how I will spend my extra 2.5 days a week with them. I'm not going to trample on their brilliance and the things that they have in train, because they really have been great. But I can see whether it's our digital and innovation space, whether it's the quality space, and looking at the golden thread of board to ward and how we really support our leaders to deliver well every day for patients, and working with our local communities. I'm really looking forward to that, because above all, those jobs really matter. And respect to my chief exec colleagues across the country who are hugging me and saying they're really pleased I'm still going to be working alongside them. So thank you to them as well. Thank you to everyone.
Claire, thank you so much for joining us. I think you've thrown a light on various aspects, not just your own personal position, but what has happened in terms of mental health services over the last few years. And we're really grateful for that. Thank you very much indeed.
Thank you. Bye-bye.
Thank you.
Well, Roy, we often say this, but a fascinating exchange with Claire Murdoch. But one of the things that just struck me towards the end of what she was saying was a degree of support for Tory ministers. She sounded like someone who really welcomed and was excited by the new administration. And she's probably being a bit more polite than she would be in private. But she is so deeply disappointed by the approach that the current administration is taking.
I think you're right. And mental health is very complicated. It's been the bête noire of so many administrations we've seen over the years. It's a very difficult thing to handle. You can't change things quickly. And of course, when you get failures, they're catastrophic failures. I think that Claire has done, broadly, I think she's done a very good job. And I think they'll miss her. I don't know who's going to come in and do the job and think they can do it better. They'll need a lot of experience. One of the things that struck me, I wasn't sure about this part-time job and, should it not be left to someone who had the full-time? But it certainly needs someone with a lot of experience, not just about mental health, but about government, about other departments of state as well, because so many mental conditions are inextricably bound up with housing and relationships and work and all sorts of things. It's a very tricky job. And the way that she's gone is a real shame. It's not good for the service. And I think we're in for a difficult time with mental health. I really do.
One key lesson from her reign, as it were, has been that while she has got some additional money, she needed ministerial support, even under the old regime. And she talked about Sajid Javid and Penny Mordaunt being helpful and supportive. If you haven't got, and it'll apply even more now, ministerial support, I think you're going to struggle. The other thing that I found, not to contradict Claire, because she was honest and frank about it all. But the reality is that in spite of all that she's done, the service is in dire straits. And it's in dire straits arguably because things have changed. They haven't just remained the same as when she came in. There's extra demand all over the place. And certainly other sectors. When I was in East Kent, we had young patients with severe eating disorders. They were simply not accepted by the Child and Adolescent Mental Service, which said, sorry, we can't take them. Within prisons, there's massive frustration, thinking these are prisoners who really shouldn't be here. They should be looked after by a different service. So I do think that what the government, in fairness, has inherited was very difficult for whatever reason. But it does strike me that they really have not, as Claire's reflected, put this as any kind of priority whatsoever.
No, I think we're in for a really difficult time. I think Claire was very frank, and dear listener, you will be the judge. So thank you for listening.
Thank you.
And here's to next time. Bye-bye now.